Yes or no? Okay. So what kind of categories did you guys come up with? Somebody in the other room, Joe, tell me categories they got. What? I can't hear you. Nephrology. Okay, patient has what? They have some chronic renal failure, kidney disease, okay? What else? What about in here?
Pulmonary.
Pulmonary. I'm talking loud and I've got a microphone. Am I like blowing you out?
No, I think it's
Okay.
good that
Okay.
it's hard to hear
So
them.
pulmonary. Cardiovascular. Okay. Anything else? Immune system. Okay. All right. So immune system. What about, is pain a concern? Would that be something we could put on a side note and say pain might be a concern? Fever might fall under immune system, or something to do kind of cross section with the COPD. Does this patient have a secondary infection? Okay. We've got the high blood pressure, patient's got diabetes, they've got a high pulse rate. So do you see how we can categorize or cluster this data for our patient? Yes? All right. Now, the next step that we're going to do is you're going to use your nursing care plan book to help you list potential diagnoses. Now, if I were you, what would be the first section you think you would go look at in this nursing diagnosis book to see problems? Right, so respiratory, or actually go in and look up COPD and see if you can find, and actually if you go in the index, look up COPD, you can look it up at the beginning under respiratory infections, or you go to the very back and look up COPD and see, because if you notice, they actually have care plans written up for disease processes. What page is it on? Did y'all find it?
I think they said 444.
444 in the new book. I don't know about the old books. Is it close? 430. Okay.
So that's pretty close.
So what I want you to do is I want you to go through that, and what you're going to do is you're just going to list the label right now. And I want you, when you're looking at this, to see what you come up with. When you look at your nursing diagnosis book and you're looking at that labels, I want you to look at, what page are we, 444? Okay. You have an actual definition, you have common related factors, and you have defining characteristics there. Look at those things and see if they somewhat match up to your patient's assessment, okay? And see if that is a potential nursing diagnosis that could be relevant for your patient. And you're going to go through and look at COPD, and then decide, is there anything else that is a concern that I might need to go out and look for, okay? And you're going to go, and if you were to see my paper that I have in front of me, I have a list of labels, okay, as I've gone through the potential problems or the risk problems for this patient that I've just listed. And you're just kind of brainstorming right now. So when you look at COPD, what nursing diagnosis do you see under there? Ineffective airway clearance. Would that be one that you would list, potentially, when you look at your definitions and all that? Okay? So what I want you to do is start going through those lists, and then also don't be afraid to go outside of COPD. Okay, if you see that, oh, this patient also has, what other problems does this patient have? Diabetes. Would that be something you might want to go see if there's a nursing diagnosis for? So look through here, just all you're writing right now is the label, and then see what you guys come up with for a list, okay? Yeah? All right, so spend a few minutes doing that.